My name is David Lin. I'm the technical director of the cell processing lab at Bloodworks here in Seattle, which includes the public cord blood bank. I'm not speaking on the role of my directorship over apheresis services. I want to thank the advisory council for me to share the impact of COVID-19 on public cord blood banking here in Seattle. And in the next 7 slides, I will share challenges and disruptions with respect to number 1, staffing, number 2, supply chain, number 3, outreach efforts. And I'll begin. So in this slide, back in early March or maybe late February, the Seattle Times published these curves of the total number of infections in the y-axis over time in the x-axis at various levels of contact reduction. And I've modified this figure a little bit with the time points 0, 1, 2, 3, 4, 5, 6 bolded in red across around the 10,000 infection mark. And time 0 is January 21, when the first case of COVID-19 was confirmed in the state of Washington. Time point 2, February 29th, the first COVID-19 related death in the U.S. was confirmed in Washington. Time point number 2, March 8th, the University of Washington announced closure of classes. They would no longer meet in person. Time point number 3, March 11th, Governor Inslee banned gathering of people, more than 250 people. Then over the next 2 days, all schools were closed, all restaurant, bars, and entertainment facilities were closed. And finally, culminating in time point number 6, March 23, when Governor Inslee issued a stay home, stay healthy executive order with the exception of, quote unquote, essential critical infrastructure workers. So I was told once in my statistics class a long time ago that all models are wrong, but some are potentially helpful. And if you follow the 25% contact reduction curve, the state of Washington has pretty much followed that line, hugged it from the beginning of this through April 8th is when this figure ends. Next slide here. Public cord blood bank at Bloodworks is located in a freestanding blood center and not on a university campus. And so we remain open. The picture shown here is the main office area of our 5.0 FTE frontline cord blood bank processing staff. So fortunately, prior to COVID-19, our frontline processing staff were grouped already into teams, and so their schedules were already staggered, and physical distancing prior to COVID-19 was already in place, and of course we kept it in place. Since cord blood processing staff are considered essential critical infrastructure workers, their work schedules were minimally interrupted. But on the other hand, non-essential cord blood bank staff such as donor recruitment staff and donor coordinators began to work remotely on March 16th. And of course, all in-person meetings were canceled and were held via Zoom meetings. So the outcome of this is that so far, our staff have not had symptoms that require quarantine, and we remain operational as far as our staffing is concerned for processing, for responding to CT requests, and for shipment of cord blood. This was Bloodworks Human Resources letter titled Critical Industry Employee Authorization to Travel. That was issued on March 23, the same day that Governor Inslee issued the Stay Home, Stay Healthy order. And this letter was passed around to all the essential cord blood processing staff so that they can come to work. This next slide is about cleaning and disinfecting of non-production areas. Very early on March 5th, phase 1, we instituted very strict policies on hand washing, hand hygiene, and surface cleaning. And on phase 2, March 20th, we didn't know, we had a lot of uncertainty about our supply chain disruptions. So I went to the local grocery store and bought cleaning pads and dishwashing liquids to clean non-electronic surface areas. And this was with the hopes of saving, making our pre-wetted 70% IPA wipes last as long as we can for electronic surfaces such as phones, keyboards, and mouse. And the outcome of this phased approach is that we still have adequate cleaning disinfecting supplies for our non-production areas. Next one is about potential disruptions to cleaning and disinfecting in the production areas. We took, on the picture on the left, we carefully allocated these cleaning and disinfecting supplies based on what we project our production needs to be. And the picture on the right is Virex. Everybody knows it's diluted at 1 to 256, which is very assuring, as is a very good alternative to cleaning surfaces to IPA. And so the result of these inventory controls and inventory supply management is that our production remains uninterrupted. Again, potential disruption to cord blood collection kits. On March 18th, we were down to 4 boxes, 4 cases of our collection kits. And this wasn't due to a supplier issue, it was due to a misrouting of our cases of collection kits. So eventually, we were able to restore up to our par level, which is about 10 to 12 cases at any given time. Finally, I want to end by saying that our largest disruptions to date so far hasn't been staffing, it hasn't been supply chain, it really has been disruptions to our outreach efforts and our plans and timelines for opening new collection sites. Bloodworks Northwest is in partnership with the Hawaii Cord Blood Bank. We've been in relationship for almost 3 decades now. Hawaii has had similar timelines to Seattle. On March 24th, on the left column here, Hawaii began to explore shipment alternatives as they were anticipating reduction and cancellation of passenger flights between Honolulu and SeaTac. And for us here at Bloodworks in Seattle, visits from our donor recruiters and coordinators to local L&D units were canceled. And on May 4th was when we were originally going to open up a new site that was out of state. But all that has been delayed and canceled due to the COVID-19 pandemic. This is the end of my slides. Thank you for the opportunity to share Bloodworks' experience.